복잡한 의료 서비스 한미 메디컬 그룹에서 도와드립니다. 이것저것 떠들면서 무의미한 검사만 하는 PPO 시대는 끝. 고민할 필요 없이 내 건강은 HMO 주치의에게 맡기셔서 체계적으로 관리하세요. 한미 메디컬 그룹은 미국과 한국의 의료 교육을 받은 60여 명의 주치의와 350여 명의 전문의들로 불편을 최소화하기 위해 한국어 서비스를 합니다. 한미 메디컬 그룹이 도와드립니다. 213-700-6711
Hello, thank you very much joining this YouTube video today. And we are here with Dr. Kevin Choi, ENT specialist. And hi. So we are going to talk about nasal irrigation. And I think a lot of people have that question. And I also had some question. And I talked to you before about this and then completely got it wrong. Or like only 20% got it right? So, yeah, tell me about the nasal irrigation.
All right. So there are a lot of different forms of irrigation that's available. The one that's most commonly used in the ENT world is Neomed sinus rinse. So this bottle is very cheap. It is very effective. The reason why we support this one compared to the neti pot is that neti pot only provides passive flow through your nose, but this also provides some power because when you look at the bottle, this is the bottle. You're able to squeeze the water out. So if you want instructions on how this is used, easiest place to go is go on YouTube and look up Neomed sinus rinse. It'll show a lot of videos on little children using it, a lot of adults using it, but this is the most cost-effective way to do it. More so because it's cheap, it's dishwasher safe, and easy to access. Nowadays, there are a lot of expensive gadgets on the market. There are ones that irrigate your nose for you even, but they usually run in the hundreds of dollars. So, we don't really recommend it too much because of the financial barriers.
I saw that from the internet that some people instruct to do the nasal wash with warm water and then put some salt in it to make it like, I guess, normal saline type of concentration. What do you think about that?
So if you just put salt in water, the problem with that is the pH is off. So it's going to burn your nose when the water goes inside your nose. That just causes discomfort and it's going to increase non-compliance.
Yeah, I tried it.
If you look in this box, you get these little packets and it has the sodium chloride and sodium bicarbonate in here at the right concentration to make sure that you're able to irrigate comfortably. So here's the hint if you don't want to buy this. Okay, you can go to the grocery store, buy some salt that doesn't have iodide in it. So usually that's pickling salt or canning salt. And then also buy some baking soda and you mix it up with water and then go ahead and irrigate. In terms of ratios, it's usually 3 teaspoons of salt and 1 teaspoon of baking soda. And that will help get the pH and the balance right so that it doesn't burn your nose.
Do you suggest to use like tap water or boiled water or?
I will say the most convenient way to do this is with tap water, right? I'm guilty of that too. I use tap water whenever I use this, even though I tell my patients not to. The reason why you can't use tap water is once in a while you'll get reports of people dying from using this. And the reason for that is because you can get fungal infections that occurs in the sinuses from the water. So patients are classically either immunocompromised from cancer treatments or treatments for their rheumatologic diseases, or they have severe diabetes. So patients like that, they're more prone to both invasive fungal sinusitis or chronic fungal sinusitis, which are life-threatening diseases. So the way to get around that is to use distilled water or use boiled tap water.
Yeah, and people do not think that fungal infection does not occur, but I have seen one. It's not pretty.
Oh, no, it's pretty disgusting. Or, there's a couple of emergencies in otolaryngology, and fungal sinusitis is one of our emergencies. I remember in residency, whenever our chemo patients had sinusitis, you called pathologists in after hours or on the weekends, and they'll have to drive in to do a fungal stain for us. So that's how seriously we take it, because it's not just us that goes to see that patient within the hour, but also we call people in from home.
So if they're doing the wash, how frequently do you suggest to do it?
I tell everyone this is like brushing your teeth for the nose. You can do it once or twice a day. If you feel better using it more than that, you can use it as many times as you want. It's really helpful for allergies because it helps to wash all the allergens out of your nose. It's a good homeopathic remedy because it doesn't have any medicines in it, essentially. For patients that I put on nasal sprays, I tell them to wash their nose before they use the spray. You got to prime the walls before you paint it. That's what one of my old attendings would tell us.
So, what you just told me about people with allergy. Anybody else that you suggest to do this?
So I don't know what the deal is with Korean patients, but they always say they have snot stuck in their nose that won't come out. And they're always like, it's always at the area, like in the back of their nose or on their palate, and they feel like they can't get it out. So they'll try to blow it out. They'll try to spit it out. So those patients, I always tell them to use it because it's the only way to clean anything out of the nose when you're home. All of my sinus surgery patients has to use this. They use it twice a day after surgery. The other benefit of this is for patients that I take care of that need antibiotics and steroids, we put them in here so that they're not taking oral antibiotics or oral steroids. Make sure you wash it. Put it in the dishwasher. Yeah.
Oh, that can go into the dishwasher?
No.
Oh, great.
Yeah, the company sells like a drying kit if you want to use it, but I think it's overrated. Just throw it in the dishwasher under high heat.
And also, tell me about the dry nose. About the Vaseline. I want you to say it again.
When you have a lot of boogers in your nose, it occurs, especially in California, where we have low humidity. And for patients who struggle with a lot of dryness in their nose that obstructs their breathing and also causes a lot of discomfort, definitely you can add saline. You can also use sprays for the nose. And then you can put some Vaseline on a Q-tip and apply it to the outside of your nose. So you don't want to be sticking Q-tips like you're getting a COVID swab done, but just on the outside, especially in the middle. And most important to do it at night before you go to sleep, because that's when the heater is on at night and the dryness will cause discomfort and also nosebleeds too.
Great. Thank you very much. And then we are going to do more ENT tips next week. Great. Thank you. Okay, bye. 구독해 주시고 좋아요 눌러 주시면 감사하겠습니다.